COVID-19 is a new mutation of the coronavirus, which was first identified at the end of last year, hence the 19. Because it's so new and hit China first, a lot of the information that we're relying on to help us in this pandemic has come from studies that were done in China. Today I want to talk about the signs and symptoms of a COVID-19 infection so you know what to look out for. Based on a study of 1,099 hospitalized patients in Wuhan, China, and another series reported from the UK, the most common reported symptom of a COVID-19 infection is cough, and that appears in 69% of patients. Fever appears in 44% of patients, the vast majority of which are over 37.5 degrees. And then in 38% we've got fatigue, tiredness, low energy. 34% of patients will be producing some mucus or cough, producing some sputum. And in 30%, an interesting one, anosmia, loss of sense of taste or smell. And in children this can be the only symptom. We also find some patients presenting with shortness of breath, muscle aches, sore throat, chills, nasal congestion, nausea and vomiting, and diarrhea, or a mixture of all of these. In most people, COVID-19 is a mild, self-limiting illness, like a nasty cold or mild flu. And the only treatment that is needed is Panadol. And note you should take Panadol and not Nurofen or aspirin. Drink plenty of fluids and rest. And the symptoms will last for between 7 to 14 days and lead to a full recovery. Some studies suggest that up to 40% of patients infected with COVID-19 get such mild symptoms that they never even realise that they've caught it. If you think you might have contracted COVID-19, call your Osana health assistant and arrange a telehealth consult with your GP. Your GP can advise you on how to best get COVID tested if that's appropriate and how best to manage the symptoms. About 5% of people who catch the virus get a much more serious infection. In some of these people, towards the end of the first week of infection, just as they feel they're starting to get better, they rapidly deteriorate. The signs to watch out for with this rapid deterioration are shortness of breath at rest, difficulty breathing, pain or pressure on the chest. And a good question to ask yourself or the person you're caring for is this better or worse than it was yesterday? What could you do yesterday that you can't do today? Being cold and clammy with pale or mottled skin. Finding that the patient is becoming confused or difficult to rouse. There may be a blue tinge to the lips or face with little or no urine output, and they may be coughing up blood. This deterioration is a medical emergency and you should call 000 and ask for an ambulance. Tell the operator you think the patient has respiratory failure as a consequence of COVID-19 infection and they will arrange appropriate management. At the moment, hospital treatment is mainly supportive, using intravenous fluids and assisting respiration when required. There are trials currently underway of several medications which are showing promise for treating COVID-19, but none are yet licensed for use in Australia. Until we have a vaccination, avoiding infection is the best course of action. Infection control with hand washing and disinfectant, social distancing are all useful in preventing the spread of the virus. Isolating older and more vulnerable patients protects them, and self-quarantine of any patient with upper respiratory tract symptoms is also vital. COVID-19 is placing unprecedented demands on our society, our economy, and our healthcare system, and we all have our part to play in managing this pandemic.